Hi everyone, today again I am in front of you and I am Dr. Saloni, as you know, and today we will be doing, apart from all nasal surgeries, rhinoplasties, lot of cosmetic surgeries which I have shown already on my channel, and ear surgeries. Though we have highlighted a lot of voice surgeries also in our channel, today I am going to show you a case of vocal cord surgery where there is a change in the voice of the patient. He experienced a hoarseness in the voice since last 6 months and came to us for an endoscopy examination. The endoscopy examination revealed a vocal cord cyst and a polyp, and we will be endoscopically removing this vocal cord cyst and polyp under general anesthesia. And this is also going to be a very interesting case, and though we see very few cases of vocal cord cysts and polyps, this is going to be a nice video, and this is a take-home message that any hoarseness of voice should be shown to your ENT doctor, and it should undergo the diagnostic laryngeal endoscopic test, because voice means a lot to anyone, any human being. Just imagine a life where you are not able to speak or where your voice becomes hoarse. So early prevention and early detection of the disease is the keynote of this video of mine. Thank you so much.